Welcome, everybody. Good afternoon or good morning, depending on where you are in the US or abroad, perhaps even. Welcome to the Award Network, the Advancing Workforce Analysis and Research for Dementia's monthly webinar series. We're really excited to have two excellent speakers today speak about the home care workforce. Before I turn it over to Weiwen Xu, who will be our host for today, I did want to remind you all that we do have future webinars coming up, and I certainly hope that you all will join and register for any upcoming webinars. We're still kind of planning them out for the rest of the year, but we do have one scheduled for September 6th, where we'll be bringing in a couple speakers speaking about some registries that they've been involved in, so that these are registries aimed at trying to improve patient diversity in Alzheimer's and dementia care research. We also welcome your ideas at any point in time. I put a QR code there for you all to scan. You can just go to our website also and go to the section on webinars and find a link at the top that says that there's a little survey there where we're taking your ideas. And thank you to everybody who has provided ideas thus far. We've been getting some really interesting ones, and we're certainly taking them to heart and trying to use them for future webinar ideas. This is a network for you all, so we certainly want to make sure that the content is useful for everybody. Now, today's webinar will be recorded, and you can also find today's webinar and other past webinars, past recorded webinars on the website also. So I certainly encourage you all to take a look there. So with that, I'm going to go ahead and have Weiwen Xu join us here. He's going to be your host for today. He's one of our committee members for the Award Network's webinar committee, and I'm very grateful for him helping to organize today's session. So with that, Weiwen, go ahead. I'm going to leave that, let you go ahead. Stop sharing. There you go.
Thank you, Bianca. So welcome, everyone. And today I'm honored to have two distinguished speakers. And this session actually is based on a special issue from Journal of Applied Gerontology, and for which Dr. Jennifer Rackery is a guest editor. And also we'll have the author, Johnny Callis, to join us. So let me first introduce them, then I will give you a little bit of the logistics about the webinar. First of all, let's welcome Dr. Jennifer Rackery from who is an associate professor at the Icahn School of Medicine at Mount Sinai. She's a health service researcher and a geriatrician who provides a home-based primary care to old adults living in Manhattan. Her research examines how home-based models of clinic and long-term care support individuals with dementia and other serious illness living in the community. In particular, she is interested in the role of paid caregivers like home health aide, personal care attendants, and other direct care workers in the home-based dementia care team, and how the care to provide matters for patients, families, and the medical systems. We also have Johnny Callis. Johnny is a PhD candidate at Cornell University's ILR School and incoming professor at University of Illinois School of Labor and Employment Relations. Congrats, Johnny. His research focuses on labor relations in the US healthcare industry, with a particular focus on the working conditions of frontline caregivers and registered nurses. Just an overview of today's webinar. So first, Jennifer will give us an overview of the special issue. Then she will share her own research article from that issue. We will have one or two questions after the first presentation, then followed by Johnny's presentation. And at the end, we hope to have 10 minutes or so for Q&A. Thank you, Jennifer. Please take over.
Great. Hi. Thank you so much. Thank you for the opportunity to present. Let me just share my screen. Just one second. All right. Hopefully that looks okay. Somebody stop me if it doesn't. But again, thank you for the opportunity to present. I'm going to start just to talk just for a few minutes, hopefully not too long, about this special issue. So this was a special issue from the Journal of Applied Gerontology in this past April called the Homecare Workforce Caring for Older Adults. I was a guest editor, and so was Cheney Fabius, who I think is here. So if anyone has questions for Cheney, she can also help answer. So like I say, I'm just going to give a little information about the special issue and then talk about an article that, that I wrote that was published in that issue. So first, a little bit about why the special issue, some insights, and then we'll go over the articles that were included. So, I mean, I think this audience obviously is interested in the dementia care workforce, interested in the direct care workforce, caring for people with dementia. And, you know, just very brief, but to talk about why home care in particular and why this home care workforce was something we wanted to focus on in this issue. And, you know, I think as many people are aware, there's a large home care workforce, 2.6 million home care workers, a lot of job growth, 1 million new jobs expected by 2030. And what the graph here is showing is state Medicaid spending on institutional care, which is the blue line and sort of trending down, and home and community-based services, which is that purple line going up. And what you can see is there's just more and more care that's happening in that home setting. And, you know, a real need to study this home care workforce in particular, particularly in the context of workforce shortages. It's important to really understand what's going on. And the reality is it's really quite challenging to understand home care. And I think one of the biggest things is that home care is not just one thing. You know, it's different in different places. It's different for different people. And, you know, and there's a lot of important considerations. So I think the first, and one people often talk about initially, is there's really a patchwork of payers paying for long-term care in the home, so paying for home care. Many pay privately, which may be, you know, on the books, it may be through the gray market. Long-term care insurance pays for a small portion, but is definitely there. Medicaid is the largest government payer for home care, but there's really significant variability at the state level about Medicaid coverage. And also Medicare pays for home care through home health aides and as part of a skilled home health episode, and also through hospice as hospice aides care for people as they're approaching the end of life. And so each of those payers, you can imagine there's different things that, you know, that can be considered about the care. And I think just in general, training, supervision, scope of practice, all vary really widely depending on location and payment source. So it can be challenging to make generalizations about home care. And I think, you know, which is sort of overarching and part of the reason this network exists is that there's really not a lot of specific data sources about home care. And so, you know, so taking all of that, it's really important to understand the workforce. Kind of what we hoped with this special issue was to also add on another layer. So, you know, not a lot of research out there about the home care workforce, but probably even less that links that workforce to the experiences and outcomes of older adults. And so, you know, I think it is really important to consider how home care and how the home care workforce matters for older adults. You know, how you can really put that care people are receiving into that total picture of what people need to continue living at home. And I think that this connection between home care and older adults is really aligned with the Journal of Applied Gerontology's focus on applied research. So it was really great that they were interested in this topic and that we were able to pull together, you know, this special issue. And I think, you know, it's a big special issue. There's 27 articles. And I think for, you know, for Cheney and myself, I mean, what we really learned is that researchers are asking a lot of questions about home care. And while the special issue didn't focus on dementia in particular, some articles did. Dementia was sort of like a through line because this is the population who's living at home. These are the people who need home care. You know, there's a lot going on in the field and it's really growing. And I think importantly, you know, as we go through the articles, you'll see lots of disciplines, lots of perspectives, and there's a lot of ways that home care, you know, you can look at it in so many different ways. And I think, you know, the findings of these many articles really are kind of in dialogue with each other and paint a really comprehensive picture about what's going on in home care and how it matters for older adults. just a few kind of insights, and actually these are related to some of those challenges. So, like we said, this diversity of home care arrangements, because of this, and, we saw this in a lot of the articles, the context of home care is really important to consider. And so I think, in other settings or in other populations, the context is kind of something on the side, maybe something you control for, but I think with home care, it's really front and center. And some of that is that the home is just a really unique work environment. And if you've seen one home, you've seen one home, and there's a lot of depth there that we need to consider. I think social factors, because of that, are really important, both for home care workers and for the care recipients. A lot of interest in structural factors. And I think just the bottom line is the context where this care is being delivered is really front and center. And the second kind of piece just to highlight is that, as we said, not a lot of existing data sets. What we really saw with a lot of these articles was a lot of methodologic creativity. People were using language analysis of recorded conversations, merging workforce data into existing data sets. A lot of qualitative work was represented in this special issue, and a lot was multi-perspective, really just getting at the idea that that home care touches a lot of people, and is important to think of in that way. And so Jeannie and I wrote an article, like an introduction article that gives a little blurbs about all of the included articles. Overall, 27 articles in 5 really broad categories. And I went back and forth of whether this was like redundant or not, but I do want to kind of quickly just run through those articles, because I think even just getting the titles gives you a sense of really what's going on here. And I would hope that, any researchers are on the call, reading what people are doing is a jumping off point, perhaps for connections, or even just thinking about this, which articles you would like to check out in the special issue, and sort of ways that I think we can all sort of expand our research world to include, some of these other perspectives. So again, I won't dwell too long. The first was about structural factors impacting the home care workforce. And so there was an article about the effects of increasing state minimum wage on family and paid caregiving. Another article, anything that benefits the worker should benefit the client, opportunities and constraints in self-directed care during the COVID-19 pandemic. An article called Using Independent Contracting Arrangements in Integrated Care Programs for Older Adults, Implications for Clients and the Home Care Workforce in an Era of Neoliberal Restructuring. Insights and Innovations, How a Local Public-Private Partnership is Building Home Care. Improving care coordination between Veterans Healthcare Administration primary care teams and community home health aid providers, a qualitative study. A second group focused on the care experiences of older adults who are receiving the home care. So I depend on her for everything. A retrospective chart review of home care worker service disruptions for homebound older adults during the COVID-19 pandemic. A second, aid and client safety should go hand in hand. Qualitative findings from home health care aides, clients, and agency leaders. A third article, Friendish, home care workers, social labor, and managing the boundaries of the care relationship. Fourth, Companions Chronicles, experiences of home care workers in the Community Elder Care Companion Program in Barbados. And next, a qualitative description of direct care workers of lesbian, gay, bisexual, and transgender older adults. So again, you guys are getting a sense of the breadth here. My article, A Need for Stability, we'll go back to that one. Enhancing dementia knowledge and self-efficacy and in-home supportive services for caregivers through online training. An article from Cheney, The Role of Dementia and Residential Service Agency Characteristics and the Care Experiences of Maryland Medicaid Home and Community-Based Service Participants and Family and Unpaid Caregivers. Language-based strategies that support person-centered communication in formal home care interactions with persons living with dementia. Better preparation and training determine home care workers' self-efficacy in contributing to heart failure care. Articles focusing on the health and well-being of home care workers. So a qualitative study of home health aides' perspectives towards COVID-19 vaccination. Personal support worker sociodemographic differences across care sectors in Canada. It hits me right here at my heart, promoting emotional health of home care workers. how to address the health of home care workers, a systematic review of the last 2 decades. And finally, a series of articles about home care worker job quality. So the hidden script of work-related burdens in home care, a crossover mixed methods analysis of audio diaries, working conditions affecting home care workers' stress and turnover and tension, focusing on the positive, home health aides' desire for autonomy and control, motivation and quality of work life in-home paid caregivers of older adults. Does connectedness matter? The association between mutuality and job satisfaction among home health aides caring for older adults with heart failure. The disadvantaged home care personal support worker, differences in job characteristics, unionization, pensions, participation in wages by care sector in Canada. And Johnny's article, Making a Bad Situation Worse, examining the challenges facing rural home care workers. And low tech, high potential, using technology to improve communication across home care workers. So a thank you to the Journal of Applied Gerontology for this special issue. And again, I hope listing everything didn't bore everybody too much, but the breadth was really remarkable. And so I think next I'm just going to go on and talk about the article that I had that was a part of this issue. And it was called The Need for Stability in Paid Dementia Care, Family Caregiver Perspectives, and worked with a really great team, Sasha Perez, Deborah Watman, Catherine Ornstein, David Russell, and Emily Franzosa. So, I think the background is what I've already said, a lot of older adults with dementia, and they want to be cared for at home. And this sort of locus of long-term care is really shifting into the community. Some of the work that I did that kind of led to this study was looking more at a national level, just at how much dementia or how much home care is a part of the care for people with dementia. So when you look at people with dementia living in the community, and these data come from the National Health and Aging Trend Study, about a quarter have received paid care. But when you look at people with advanced dementia, so dementia and also impairment in daily functional tasks, about half receive home care. About 30% receive more than 20 hours of care per week. And when you look at actually the mean, it's around 50 hours of care per week. And I think, what really strikes me about this is that, paid care is one part of the total caregiving that people receive. And paid caregivers and family caregivers of people with dementia really are working together closely to provide total care. This is a graph again from that same study of NHATS in 2015 that I think gets to that a little bit. And particularly if you look on the right-hand side here with advanced dementia, people with advanced dementia who received paid caregiving on average had about 50 hours of paid care and about almost 70 hours of family caregiving. And I think for this reason, how we've come to kind of think about this in our group is that, you have a person with advanced dementia who's living at home, and you have their paid caregivers and you have their family caregivers. And there really is this kind of core caregiving network that is important, that matters, for outcomes for that person with dementia, for the family, and for the paid caregiver. And so in this study, this is a qualitative study with family caregivers of older adults with dementia. And the goal was to really kind of look at two pieces of this. So the first was kind of this first part, what is the role of paid caregiving in home-based dementia care? Again, from the perspective of family caregivers, how do they see paid caregiving fitting into that total care in the home? And then how does that care provided by the paid caregivers matter for people living with dementia and their families? So like I say, we conducted qualitative interviews with family caregivers of people with advanced dementia living at home. And they were recruited through a large home-based primary care program. So the one that I was working for. So how it worked is the physicians actually identified someone with dementia first. So someone with dementia, advanced dementia, who had both paid and family caregiving. And we approached the family caregivers about an interview. Interviews were in English and Spanish, and this was sort of this October to November 2020. So just, because it was kind of directly after COVID, this project, when we asked questions, our big questions were the same. What's the role of paid care? How does it impact people with dementia and family caregivers? But we really tried to focus in on COVID a little bit too and talk about that, ask questions related to COVID. Interviews were by phone or by Zoom, and we used a thematic analysis with inductive and deductive approaches. And so these are the characteristics of the people who were included. So the people with dementia, you can see, quite elderly. About 10 of the 15 were Hispanic or Latina. About 13 of the 15 had Medicaid and Medicaid funded paid care. And they were really a very impaired population. So 13 of the 15 were dependent on all ADLs, including eating. And 11 of the 15 had 24/7 paid care. The family caregivers were predominantly the children of people with dementia, 9 of the 15, and only 5 lived with the person with dementia, and many worked outside the home. And so this is kind of our summary of how, the themes and how it all fit together. So, one of the real things that family caregivers talked a lot about was just how vulnerable people with advanced dementia were at home. And this was a really kind of constant theme, just how vulnerable and how challenging it was to leave their family member with dementia at home with a paid caregiver. And thinking about paid caregivers, people talked about the right paid caregiver, someone who was a good fit, someone who was caring. And then an important theme then was continuity. So paid caregiver continuity of that individual who was providing paid care. And this kind of resulted when there was the right person and there was continuity in a kind of stable paid caregiving relationship. And that's what really led to the positive impact of paid care for people with dementia and their family members. So just a few, quotes that I'll read just to pull out, but this vulnerability of advanced dementia is something I've certainly thought more about since this. And a caregiver, a daughter, said, "You worry a great deal because you're entrusting your parent that you love a great deal to a total stranger. Now, a regular person can really tell you, okay, this person pushed me or whatever, but a person with dementia who can't tell you that something happened, that's a lot of worry to me." Second theme was about the right paid caregiver. So someone's husband said, "I think I probably had during that initial time at least 10, 15 different people. I didn't have the greatest experience with a lot of people. And so finally, I settled down on one person who's very good and knows about this. Her mother had a similar problem of dementia, so she knew exactly what was going on, and she's doing an excellent job." And so, I think this is again, to me, something I've been thinking about, the idea of a good fit and finding the right person, I think gets at the important ways it's not, an interchangeable home care worker. And continuity, a daughter, caregiver 11, said that somebody new would come in and I couldn't be there. Like my mother, anybody new would scare her. She would be uncomfortable. So I was concerned that a new person might have to come in, and how do I deal with this during COVID? And I just, as an aside, so like this, COVID did come up, but quite honestly, it wasn't really one of the major themes. And I should have said this before. We asked everybody about COVID. COVID was obviously on everybody's minds, but it seemed almost like COVID exacerbated whatever was happening. It heightened sort of all these other themes, these issues of vulnerability and stability and continuity. But in and of itself, it didn't necessarily introduce something new, at least for these group of family caregivers. And finally, the last theme, that stability impacts people with dementia and their families. And so here we kind of try to sort of juxtapose the benefits to the person with dementia and the benefits to the family. So caregiver 18 said, "I feel my mother would notice her paid caregiver and light up. She knew who she was, and she was so happy to hear her. And that's great when you see it." And about herself, she said, "I felt confident enough that I could leave my mother, that I could leave, and that my mother was going to be well there. If I didn't have that service, well, the two that I have here now, which, like I said before, we've created a bond. I don't know what I would have done without them. I think I would have had to leave my job." And just one more, besides taking care of my mother, feeding her, bathing her, and clothing her, the paid caregivers do all that. They sustain her. They sit with her. They talk to her. They laugh with her. I don't know what more to say, except they just do, I think, what they would do for their own mother. You know what I mean? They're doing what they would do for their own parent. And the caregiver said of herself, "I just feel a sense of peace because my mother is being taken care of by two women. They allow us as a family to have our own lives and to be able to keep going. It makes us better people because I remember in the beginning, I was so frustrated with my mother. I was so angry because I was so tired and I had a lot of resentment. I felt like I was taking it out on my mother, like I was mean to her, and I hated myself for that." And so, to summarize, I think what we really are finding here is that paid caregivers, they really can play this essential role in home-based dementia care. They can have this meaningful impact on outcomes for people with dementia and their families. But given this vulnerability, it's not enough to have a warm body of a home care worker there. You need the right fit, you need the continuity, and this is having really made a difference for these family caregivers. So I think, obviously lots of limitations, and I think it's, our sample is unique. It's in New York City, urban, lots of Medicaid funded care, high levels of care, a largely Latino or Latina population, high care needs, and people who are really connected to the care system. So these are people getting home-based primary care who've kind of already been through it all to get that care support they need in the home. But in my opinion, I think it's what makes these family caregivers really key informants. Like they've been through a lot. They're in a place, they've managed to keep their family member with advanced dementia living at home, and they have a lot of insight into things. So I think the implications, again, paid caregivers are not interchangeable, and care is more than just completing these discrete tasks. And I think this begs the question of how we can facilitate person-centered home care that meets the unique needs of each person with dementia. And these were themes that came up in other of the special issue manuscripts as well. And second, the stability of a well-matched paid caregiver is essential for the benefits of paid care. I know I've done lots of work that really tries to talk about, how paid care impacts families. And I think one of the challenges is that paid care isn't just one thing, and we need to think more about that sort of quality of that care. I think this has implications for agencies. How do you promote good matches? How do you facilitate the building of these trusting relationships that seem at the core of that impact? And how can continuity of paid caregivers be tracked or incentivized in some way, but also still allowing for that good fit? Because it's not just anybody who's there all the time. It's the right person who's there in a regular way. And I think also too, just in general, this idea that paid care is real, when you're working with people with dementia, it's really central for families too. So we had an immediate next step that came out of this. So it was really exciting. So this work informed a pilot project that was looking at this continuity quantitatively. So looking at the relationship between paid caregiver continuity and care recipient outcomes. And these were people who were enrolled in a large Medicaid managed care program in New York City through the VNS Health. And so this was a really, it was a pilot, but the paper is under review. And we did find that continuity that you could sort of measure by connecting with home care agency records. The continuity of care for individual people was associated with improved functional and psychosocial outcomes, which is really exciting. I'm thinking more general next steps. I think, I do want to try to figure out how to kind of get more at this relationship between paid care and outcomes for people living at home. And again, with advanced dementia, because I do think, the care needs are very different for different people, but this advanced dementia population is particularly vulnerable. And then the last piece I'll mention is just, again, this idea of high quality dementia care, right? So is continuity a good measure of that? Are there other ways to get at what high quality dementia home care would look like? So to kind of move from basically like, is there home care? Yes, no, to what does that care look like? So I just want to thank you. Thank you to the collaborators, colleagues, and the award network, and happy to talk with anybody. And if we have time, you guys can let me know. We can take a question or two now, maybe, but if not, then we can take them at the end, whatever you think.
Thank you for the presentation. I learned a lot through your presentation. So we do have one question, Jenny. So the question is, excited to read your VNS paper. How do you measure continuity?
Yeah, I'm excited about that one. That was really fun. So we use the Weiss-Boxerman index, which is an index that is pretty commonly used to measure continuity in the healthcare setting. And it's basically, I think it's really looks at dispersion along the mean. So how we did it is that we had care assessments as part of sort of standard care assessments every 6 months, and we were able to link the records to the licensed agency providing the paid caregivers. So we were able to sort of see how many different individual paid caregivers somebody had over that 6-month period and calculate the continuity based on that. And all the outcomes came from these standardized assessments. So I think it's a promising approach. And I think, like I say, directly informed by this qualitative work to try to measure some of these important factors in a quantitative way.
Excellent. So I think we don't have additional questions. We can just hold until the end, and people can ask a question at the end. So please type your questions and we will address them later. Thank you. Hi, Johnny, it's your turn.
Sounds great. Let me just share my screen. Okay, so hopefully that should be good. Somebody let me know if not. But thank you so much, everybody, for the invitation to speak here today. So I'm going to present a recent paper, Making a Bad Situation Worse, examining the challenges facing rural home care workers. That was published as part of the special issue that Dr. Reckery just discussed and guest edited along with Dr. Fabius. So this qualitative study focuses on rural home care delivery, and specifically rural home care workers, direct care workers who provide a range of tasks to many clients on a daily basis and are obviously an essential component of home care delivery. So I just want to give a special thanks to the many co-authors who helped with this paper, and a special shout out to Dr. Madeline Sterling, Professor Nikki Dell, and Dean Ariel Abgar. Without their supporting guidance, the study certainly would not have been possible. So as we all know, the U.S. home care system is confronting a considerable care gap. As the population ages and more people want to age at home, the demand for home care services continues to outpace the number of home care workers, as nearly 7 million direct care workforce jobs will be needed filled by 2028. This care gap is especially pronounced in more rural areas. So senior citizens are expected to comprise approximately 28% of the rural population by the end of the decade, compared to 20% in urban and non-urban areas. We know that people who live in rural areas experience worse health outcomes and have less access to healthcare services, including less utilization of home care services. And the trend of nursing home closures and mergers in rural areas place an even greater burden on the home care delivery system. So to confront this worsening care gap and to identify opportunities for improvement in rural settings, we need to understand the challenges facing rural home care workers. And we can think of two types of challenges for the purpose of this study. So the universal challenges that confront all, or I should say a lot of home care workers, such as low compensation and high turnover, and then challenges confronting rural caregivers specifically. We also need to understand how universal challenges compound unique challenges and vice versa. And while an increasing amount of research has begun to examine these universal challenges, generally through studies of workers in more urban areas, the minimal research on rural caregivers often focuses on specific issues like turnover, on workers' role in broader healthcare teams, rather than categorizing broader challenges, which we hope to do in this paper. So we argue that we need to understand and categorize the broader challenges facing rural home care workers to determine how to best support these workers and confront the growing care gap. And we aim to do this by talking directly to these workers about their experiences, which we try and do in the paper. And the main research question that really motivated the study is, quite simply, what are the challenges facing rural home care workers? So we began our research study through outreach to multiple types of home healthcare organizations and organizations who operate in the home healthcare space, including unions and other labor organizations, home care agencies, and local long-term care committees throughout upstate New York. These organizations helped connect us with potential interviewees and provided us with a general understanding of the challenges facing the long-term care system in rural parts of upstate New York. So because of the limited research on the challenges facing rural home care workers, we decided to complete a qualitative study that would start to understand and classify these unique sets of challenges. So we undertook an interview-based study from July 2021 through February of 2022 and interviewed a range of rural home care workers, mainly those who work through agencies, but also others who work through private employment registries as well. And we defined rural fairly broadly for the purposes of this study, really any place that isn't a major city such as Syracuse, Buffalo, Rochester, or Binghamton, or Albany, or an immediate suburb of that city. And we recruited most participants from more rural areas of Erie and Onondaga counties, and also from some of the more remote parts of the Adirondacks and the North Country. So we conducted 23 interviews, which consisted of 19 home care workers, 2 agency representatives, and 2 long-term care policy advocates. Just a couple notes on the participant demographic. The average age of a participant was about 54. The vast majority identified as female, perhaps reflecting the demographics of more rural communities. Most of the home care workers or participants we interviewed were white, 83%. And then in terms of just going down a little bit, the mean number of years for the home care worker section of the sample was about 16 years employed as a home care worker, and there was a fairly even distribution between full-time and part-time home care workers as well. So from our analysis, we identified distance and transportation as really the major challenge or theme confronting home care workers. And then we found that distance and transportation really exacerbated other challenges confronting rural home care workers, which we identified through 3 sub-themes. 1, workforce and workflow issues. 2, client isolation and noncompliance. And 3, poor working conditions evident more broadly in the home care field. So just to walk through each of those themes and some quotes that is really where we generated this analysis from. The primary challenge confronting rural home care workers in our study really related to distance and transportation. So workers put a considerable amount of miles on their vehicles and need to have reliable transportation when dealing with the upstate New York climate, especially in the winter. One caregiver reported traveling approximately 800 miles a week due to having multiple clients a day at only 1 or 2 hours a day. The average travel time between clients in the Adirondacks region, which we gathered from interviews with agency representatives and workers, is approximately 30 minutes between clients. So difficulties associated with commuting to and from clients' houses really came up repeatedly throughout the interviews. And these distance and transportation challenges really negatively impact the experience of not just home care workers, but also their clients, as the following 2 quotes illustrate. I'll read out the second quote. I mean, travel-wise, winters can be pretty drastic around here, so I make sure I have snow tires now. There's been times I haven't been able to get to clients because they're so far out in the country and snow blows over the roads, so that can be a challenge. They would go without care for that day, really speaking to or demonstrating the impact that this has not just on caregivers, but also clients. So the first sub-theme we identified includes workforce and workflow challenges, largely due to what's sometimes referred to as a shortage of caregivers available to work with clients in more rural areas. And this first quote from a home care worker really demonstrates that. Quote, I would say, although I don't think it's unique, it seems to be everywhere now, but just a lack of help. We don't have home health aides, especially that travel in that area. If I'm not here, if I don't go, they really don't have coverage, close quote. Many aides identified increased compensation as a way to attract more workers into the field. One agency representative we spoke to discussed how they would like to increase pay, but the reimbursement scheme is set up in a way that inadequately compensates agencies for travel time between cases when agencies still pay caregivers, or some agencies do, but are not reimbursed at the same rate at that time. And with travel times of approximately 30 minutes between each case multiple times a day, that obviously has profound implications on pay and compensation. We also noticed that aides overwhelmingly work short cases, 1 to 2 hours in rural areas. More research is needed to determine if this is unique to rural areas, but it clearly impacts the type and extent of care that home care workers provide, as the first quote demonstrates. Quote, going to the grocery store in the 1 to 2 hours that I'm with them, yes, I've gotten pretty quick with things. So like a lot of my clients, they'll pile on a bunch and say, I need you to do all this stuff in like an hour, close quote. So the second sub-theme we identified involves a patient social isolation and noncompliance. These are very much universal issues or challenges confronting home care workers and clients, but we argue that these issues are more exacerbated in rural areas. Living in a particularly remote area may prevent much interaction with the outside world, as evident in the first quote here. Quote, I have somebody that's actually on a private dirt road. Sometimes we just walk to the end of his driveway, but that's the extent of the fun there for him, close quote. And this physical isolation may also lead aides to feel lonelier and more isolated on the job, but we definitely need more research to determine whether that's the case. And then the attitudes of rural residents may also lead them potentially to resist care in unique ways. These attitudes impact the daily work of many caregivers with rural clients. So just reading out the second quote here, quote, it's more farming, more farm towns. They're used to living or doing things with less. I've had people that they never took a bath before. They wouldn't shower. They'd only bathe, close quote. And then finally, rural home care workers confront poor working conditions prevalent in the home care profession more broadly. The first quote demonstrates the impact of low wages on turnover, an issue particularly problematic in more rural areas. Just reading out the bolded part, quote, I've been there for 9 years and my base pay is under $15 an hour. That's absurd, close quote. And then distance and transportation can very much exacerbate these more universal poor working conditions. So another caregiver discussed in the second quote, we're all driving our cars into the ground. If something breaks down, we're calling in, and then that's docked against us, close quote, speaking about the challenges and the just overall mileage that home care workers need to place on their cars, often driving through inclement weather. And then finally, transportation challenges can also place an additional emotional burden on caregivers who work with clients in more remote areas. So one home care worker explained a particularly noteworthy story about a time when they had to go to a client's house a night early to make sure they received care. Quote, I went and spent the night with her a couple of times when I knew we were going to have a severe storm the next day because there was nobody to get to her house. So I did go spend the night with her. I slept on the couch and we had a slumber party. I did that on my own. I didn't get paid for those times, but I get to know my peeps and I love them, close quote, which really once again demonstrates, in this case, unpaid labor, more emotional or invisible labor that's very much compounded by these distance and transportation challenges. So just a couple quick concluding slides. So how do we think about implications or policy change given these findings? So we want to first emphasize that regardless of specific policy solutions, we really need policy awareness that these issues such as transportation and infrastructure investments need to be part of the conversation on how to address problems with our long-term care solution. An important first step is to encourage pilot programs to address obvious challenges through efforts such as a transportation pilot undertaken by Cornell University's Worker Institute and Healthcare Workers Rising, a labor organization in upstate New York. Transportation, as I mentioned a few times now, was the most prevalent or common challenge voiced by home care workers in our study. It's also a very logistical and technical challenge that should allow for some creative solutions. So the Cornell pilot provided fully subsidized rides for workers to reach clients using a rideshare system in multiple Western New York counties. Workers indicated that this program helped expand work opportunities and reduce the stress, and more pilots like this should certainly be encouraged. And then finally, efforts to address quality of care concerns for rural patients need to account for the unique challenges associated with the delivery of rural home care. For example, reimbursement systems need to account for the geographic realities of care delivery in rural areas, such as by reimbursing agencies and making sure that money goes to rural home care workers for travel time between clients. State and federal policies need to address low compensation, inadequate funding, and invest in both urban and rural home care work. The bottom line here is that policymakers need to address these challenges and shoulder some of the burden that very much is disproportionately impacting caregivers. Okay, so I'll stop right there. Thank you so much for your time. Looking forward to the Q&A.
Thank you, Johnny. I can imagine because I lived in Rochester, New York for 7 years, traveling in the wintertime for 30 miles to take care of someone. It's not an easy job. Oh, Bianca has some questions. Go ahead, Bianca.
Hi there, great presentations. And I realize I can't enter questions into the Q&A box like others, but really, really interesting work. I'm curious, a lot of times the conversation around home care workers seems to identify one home care worker to one patient. But from what I understand from some people's experiences is that sometimes there are multiple caregivers at any one point in time, which certainly makes some of the estimating how many caregivers do we really need or home care aides do we really need kind of challenging. But I'm curious how that kind of it looked in both of your studies in terms of how, whether there were any issues around managing multiple caregivers, managing the relationships between them, and how that kind of played out at all in your studies.
I can go first. I think that's a really good question. And I didn't say it when I ran quickly through my table one, but of the people with dementia who were in our study, they had on average 3 paid caregivers. So again, if you have 24/7 care, there's a lot of people kind of coming and going. I think it's an interesting question, not in this project, but sort of in a follow-up project where we were interviewing the paid caregivers of people with dementia. We asked them to identify the primary paid caregiver, and it was really interesting. It seemed like there was often, when there's multiple paid caregivers, there was often one who kind of was more in charge and almost took like a leadership role. But in this project, and in others, we've definitely heard challenges of, almost like blame of whose fault it was that something didn't happen, that this person wasn't taking good care. But I think at least, from what we found, it's hard to make generalizations because I think those relationships are all very different. So I've talked with people with dementia about their paid care, and when they have multiple paid caregivers, some are close and work with each other closely. Some never see each other. They are 8-hour shift. Somebody else has an 8-hour shift. And I think there's really a wide range of relationships. So I think, obviously, it's not the same as family caregiving, but there are a lot of similarities in terms of this idea of a network and how the network works together, and and just how different those relationships can be. I don't know, Johnny, did it come up for your?
So we didn't interview any patients or clients, so it's sort of hard for me to speak to their perspective, but definitely from the standpoint of the home care worker, a lot of caregivers worked with, as I said, multiple clients a day, just for a couple of hours a day. So I think there are important implications of those shorter cases. And once again, I don't have the data to back this up, but when you work just for a couple of hours a day and then you're traveling 30 minutes between patients, maybe it's harder to form certain more emotional connections with patients or be able to provide them the care. Having communication between different caregivers is also a challenge. But in more rural areas, it can be difficult to find help, as some of those quotes illustrated. If that person's not able to go out because of snow issue or weather issues, or because of the caregiver might be sick or some other reason, then that client will go without care. So there's definitely a lot of implications. That doesn't directly answer your question, Bianca. But.
Jenny, I have a follow-up question. So you mentioned when there are like multiple paired caregivers, sometimes the one's in charge, but who is coordinating all of them? Like who will arrange them? It's the family members or it's the agency?
In the work that I've done, it's the family, so I worked on a paper that literally was called like I am the home care agency, because at least in the groups that I've interviewed in New York, even if someone is a paid caregiver is employed through the agency, that agency role tends to be more about scheduling and coordination and not about the content of work that's happening at home. And I think it really, I think, falls to the family much of the time, at least, as I've talked to people about that. Yeah.
Yeah, I can imagine the burden on the family members, right? Even though you have people to take care of your demented family, but yeah.
And they want to too. It's an interesting, I feel like it's like why that sort of network idea is important, because it's, people, and this is actually, I'm looking at Jennifer Morgan's question in the chat. I mean, I think it's connected to this idea that there's people get a lot out of the caregiving, and I think families want to take it on, and they want to be confident that the other caregivers in the home, the paid caregivers, can be can be trusted and are, doing it for the right reasons. So everybody is, or often anyway, seeking out relationships and really trying to figure out how to work together because they know it's so important for people with dementia.
So, Jenny, you just want to go ahead and answer the question, as you can see.
I don't know how to answer this. Okay, so Johnny, maybe this one's up next for you. The question, I can read it, is some of the work on direct care worker retention has focused on both extrinsic, so pay, benefits, transportation support, and intrinsic rewards, recognition, meaningful relationships. How is this represented in the home care workforce and its relation to care for people living with dementia? I think that's a very good question. Johnny, you want to go first, and then I'll
try, and then you can follow up. I think that's an excellent question. I think a lot of it, frankly, right now for rural home care workers is not necessarily being incorporated, right? So some of these more external benefits, if you will, in terms of pay and other benefits. Rural home care workers also have to maintain their own vehicles, right? They don't, a lot of the times, necessarily have a company vehicle or receive subsidies for their own car. So that's a big external benefit. As one of the quotes I demonstrated, there could be additional impacts of more emotional burdens of labor, those more intrinsic sort of values that you're getting at. So an aide who is going to go into somebody's home to make sure they have care, staying with them the night before, that's entirely unpaid labor, and that comes from their relationship. So right now, I don't think these factors are necessarily being accounted for in policy discussions. Maybe Dr. Reckery, you would know potentially more about that than I do, but I think they absolutely have to be when you're looking specifically at rural home care workers.
Yeah, that makes sense. I don't know, but I think those are good points. And I think, for me, or coming out of this work, the only kind of thing to add more in that intrinsic reward piece and how it works for care for people with dementia is this role of the family too. It's not just the home care worker and the person with dementia. There is someone else. There's this other layer of relationships, which I think can influence many of those things. The recognition, meaningful relationships. Sometimes it's with the care recipient, but I think it can often be with the family members. And when it's not there with the family members, it makes the work challenging, even if that relationship is meaningful with the person who's receiving the care. It looks like there's a follow-up question too for Jenny. Do any of the agencies have memory care directors to supervise the caregivers, as that would be the most useful to assist both the clients, caregivers, and families? I think that's a very good question. I mean, I can only speak to the kind of the interviews I've done where I've gone a little bit more in depth, and it wasn't quite with this study, but sort of a follow-up piece. At least for this, people who are receiving Medicaid funded paid care in New York City, the role of the agency was really super limited for the most part. Like the agencies weren't involved kind of in the day-to-day care. And there was some, level of dementia training, but not in kind of a day-to-day way, not in an ongoing way. One exception, and again, it's like a single case that came up in my work, there was a private agency. So it was someone who's paying privately for home care in New York City through an agency. So kind of like a high-end situation. And in that particular setting, actually the agency was incredibly helpful to manage the dementia care, to coordinate all of these things. And so it was almost like an added benefit. And, at least in our environment, the Medicaid funded care, you just don't get that level of support from the agency. It's not a meaningful source of support for families and aides, even though, it's everybody kind of says the agencies are overworked, the care managers are overworked. It's not, they're not providing that really kind of care that's unique to that individual person with dementia.
Well, a lot of questions. Another question, it's pretty rare for discussion to include transportation support and money company car in terms of direct care workforce rewards. It's an across-board issues, but certainly for rural healthcare workers, I want there's some room here for policy work. Also, I'm curious if you see any offering from EAP programs for better or any mental health support for workers, families even. Great question. Thank you, Jennifer.
So I can share actually one story sort of on the front part of that question. I'm not sure as much about the EAP programs, but There are some counties in upstate New York who have very limited sort of direct care programs where they're able to hire home care workers directly through the county, provide them with their own vehicles, and it actually provides for a really powerful potential model. The problem is it hasn't been able to get to scale, just there's not enough funding or resources for that. But that in a lot of ways is a potentially ideal version if home care workers can be employed potentially through whether it's a county or some other, even through an agency with fully subsidized transportation, being able to have vehicles provided for them that could overcome at least some of the transportation challenges.
I mean, the financial implication is huge, right? If you have to supply a car and the gasoline, it's very expensive. And if you think about how much Medicaid pays for the direct care workers, it's like 15, 20 hours an hour. So that's not enough. It's not enough at all. So.
And I think that's connected to the second part of the question too, in terms of like EAP programs. Like, I think that we've definitely seen interesting things, but they tend to come and go because they're, maybe like you described too, Johnny, these pilots, or there's funding for a short period of time to do something or to create a support program. But how you kind of sustain that with the reimbursement environment is really tricky.
Great. I have another question from Bianca. It's kind of unrelated to research, but to the guest editor experience. So can you reflect your experience being a guest editor? And if people want to do it, like what's the process like?
That's a good question. So it was a pretty amazing experience for me because I've certainly reviewed a lot of articles, but to be able to kind of, to have that role in bringing them in. And also, I think we had an interesting process. I think initially the call went out and very few manuscripts came in. And then as we got to the deadline, there was like a lot all at once. And so there was times in there of trying to like reach out, trying to get people to submit, trying to like encourage and spread the word about this, about this special issue. So I think that role of it was really interesting. I mean, as I kind of went through so many different approaches. And I think like that, it made me realize in that way that like kind of the network I reached out to say, you guys should all submit your home care manuscripts. It was just one tiny piece of this massive number of people who are looking at this issue from very different ways. So I think it was pretty humbling. And honestly, I think, like I say, Cheney is one of the attendees. So I think Cheney's the one who got me on board. I think it really started, though, with interest on the part of the Journal of Applied Gerontology for this as a topic, and people, on the editorial board who were really advocating as something important and timely. So, honestly, I don't know, I wasn't there when those things happened. I just felt very grateful to be kind of included in the execution end. But I think, I would hope that there would be more of this type of work, because I do think, when you pull all sorts of articles together, you see the through lines, you see how they're connected, you see the kind of how this research is really in dialogue in a way, at least for me, that I don't see when I'm looking at PubMed or Google Scholar and clicking one by one. I think you get a sense of the body of the work, and it certainly made me feel optimistic about this as a research topic, and the many questions people raised, and each article raised more questions for us to kind of continue to try to chip away at.
All right, it's right at 12. Thank you so much both for your time, and thank you the audience for staying right at 12. And I hope to hear more about your research in the future, and welcome back to present to our award network audience. Thank you so much.
Thank you.
Thank you so much. Bye-bye.
Bye, take care.